So, hello everyone, here I am with today's editorial of 27th August 2021. Before we move further on to read the editorial, let us have a quick glance over the new words or the vocab words that we are going to come across. The first one is fraught. It basically means a course of action likely to result in something undesirable. So you perform a deed and it doesn't turns out the way you want it to be, and it's not fruitful, and it is in negative sense that you expected something great, but it did not turn out the way you want it to be. The second word is amidst. It is in the middle of. Even if you look at the word, it contains mid, and from that you can make it out that it is talking about something middle. Pandemic, prevalent over a whole country or the world. So I'm sure you all might be aware of this word because currently we are suffering from the COVID pandemic, and it's prevalent all across the world, and each and every country is suffering from it right now. And from the word pandemic, there's another word that rhymes. It's called endemic. So sometimes we get confused. So endemic is it happens to specific people or specific species or specific breeds, and only it is localized, not all over. But pandemic happens to all, and it is spread across the world or the country, so it does not discriminate amongst anyone. Epidemiologist, that means a person who studies or is an expert in the branch of medicine which people deal with incidents, distribution, and possible control of diseases. So it is epidemiologist is a person who is an expert in the branch of medicine, and they take matters of pandemic into hand, and they decide like what precautions need to be taken and what measures and steps need to be taken in order to prevent people and prevent the disease from spreading, and also what can be the cause and cure of the disease as well. So I'll just tell you a basic thing that if you see ist in any of the word, that means an expert or an specialist. Next word is calibrated. It means of an instrument marked with scale of reading. So it can be any instrument, starting from the rulers that are there in your pencil boxes to the weighing machine that you see, because they are marked with scales of reading. Next word is crippling, causing a person to become weak, to become unable to walk or move properly. So here it's basically talking about physical. If you look from unable to walk or move properly, so it is physical, but it can be even mental. So you can make someone weak mentally as well as physically. So if you take an example, old people, the old aged people, they might not be mentally weak. They are mentally strong enough, but they are physically weak. They cannot do all the things they want to do on their own. Next word is collate. It means collect and combine, not everything, anything you find, but it is in the context of text, information, and date. Next word is prospect. It means the possibility or likelihood of some future event happening. So you can see the sky, and if it's dark and cloudy, you can prospect or predict that rain is going to happen. So that's weather forecasting. Coherent, of an argument, theory, or policy, logical and consistent. So anything that's logical and consistent, that's for a long time, that is called coherent. Now let us move on to read the article. So the article says learning safely. By reading the title itself, you can make out that it is talking about learning, so education and reopening of schools. As schools prepare to reopen, the focus has to be on vaccination and safe behavior. So as the schools are opening, we need to focus on sanitation and prevention, like wearing of mask and washing hands after a period of time, and maintaining distance and everything. And at the same time, we are taking risk with our children, because until now with time, all the offices for the old ones, for the aged people or our parents, it has already opened. But if you look for the children, they're delicate, and they are and their schools haven't been opened, although it said that they have more immune. But none of the parents would like to take a or risk their child's life by sending them to school. So it is very important or very crucial for us to take all the precautions and everything in order to maintain the safety of the children. The centers moved to allocate 2 crore coronavirus vaccine doses for universal coverage of all teaching and non-teaching staff in school by Teachers' Day, September 5, adds a measure of confidence that resumption of face-to-face classes from September is not fraught with high risk. So the move that was made by the center, that was to allocate 2 crores rupees in order to vaccinate all the teaching and non-teaching staffs of the country, uh, so that when they go into school they're immune to coronavirus and they do not spread it to the children. And also is this can guarantee us that there'll be a bit low risk of COVID-19 spreading in the schools, where a huge group of children come and learn together. And they have assured this that by September 5 they'll vaccinate most of the teachers. Several states are preparing to reopen schools, mostly for class 9th and higher, next month. Some, including Haryana, Telangana, and Gujarat, have announced that they will allow offline classes even for younger children. So, where some states are saying that they'll allow opening of schools for 9 to 12, that is higher classes. At the same time, there are other states such as Telangana, Haryana, and Gujarat. They have said we'll also open it for younger children, that is from 6 to 10th, or sorry, 6 to 12th. And at the same time, so here you can make it out that this decision of opening of schools is not in the center's list, not in the center's list, but and neither it is in the state list, but I think it's in the concurrent list. That is, both state and center can make decisions on it. And at the same time, as the COVID cases, the number of COVID cases coming every day varies from one place to the other. So it is even in the hands of the local bodies that they can decide whether to open up schools in their locality or not. So like in some places the COVID cases are increasing, but at the same time in some other place it's not that much, it's just decreasing. The number of cases coming every day is just decreasing rapidly, so there they can open up schools. So it varies from one place to the other. Amidst fear of the third wave, the pandemic, epidemiologists, academicians, and policymakers have been wrestling with the question of a low risk trade off, balancing protection from the virus with some bridging of learning deficit caused by prolonged school closures that are crippling future prospects of millions of children. So here it's saying that at this time, when we are in such a vulnerable situation, we are like the epidemiologists, that is from this sector of medicine, from the sector of education, and from the ruling section, that is from the section of politics, all of them, they are pondering about this question, that whether in the present situation we should open up schools or not, because the health and education both have equal importance. And if you don't have health, then what's the need of, if you're not healthy enough, then what's the need of acquiring education? So there's quite a lot of dilemma, and a lot need to be pondered upon it. So they all are wondering that whether we should open it or not, because if we do not open up the schools, there's a huge portion of the country, or a huge portion of the youth of the country who are lacking, who are deficit in this education, because in the online mode, less than less than 50% of the children or their parents own a smartphone, and even amongst them, only a few are able to attend classes because of poor network connectivity. Okay, so poor network connection. So a very small amount of children are able to actually attend online class and gain some knowledge. But at the same time, even among this, there's a problem that if just consider a situation, there are five children in a family, and there is only one phone. So how to share among one phone amongst five of them? Because most of the time the online classes run parallelly for all of the classes, that is in the morning. And there, so here in some places discrimination also plays a vital role. That is, if there is a boy, so they'll give the phone to the boy to attend the classes, and the girls will lack it. That is poorest of the poor, as you might be aware. So there's a lot of education gap, and they are lacking. So at the same time, they have to maintain the education and the health sector as well. So yeah. So yeah, okay. It is crippling future prospects of millions of children. It is encouraging the half of the 97 lakh teachers in the country have already been immunized, by official estimates, making it feasible to reach the rest by September 5. So, of the 97%, 97 lakh teachers in the country, uh, until now, what the official records say, 50% of 97 lakh teachers have been already immunized or vaccinated. That is approximately 940, okay, 48.5 lakh teachers have already been immunized. And the government is assuring that by September 5 they'll vaccinate the rest of them. The risk of infection to children in school remains, however, and must be addressed with utmost seriousness, particularly with fast transmitting virus variants present in all states. This calls for a coherent response that incorporates the best learnings from epidemiology and decentralizes decision making to districts based on local circumstances. So here it's saying that despite the fact that we are vaccinating all the teachers and non-teaching staffs of the school, still there are chances of people having COVID-19. And there's, because school is a place where all of the students and teachers meet, and that not only one or two, but that is in a huge number. So there's a like very much chances of COVID-19 spreading even if one of them catches it. So here it's saying that in schools the risk of COVID-19 infection spreading remains, but at the same time, so this is also the responsibility of the schools and the teachers and the children themselves to take their responsibility and to maintain and follow all the precautions that have been shared with them. That is maintaining distance, wearing masks, sanitizing your hands or washing your hands periodically, and at the same time covering your mouth when you're sneezing, not sharing of food and everything. And we know that children are quite attached to their friends, but still they need to maintain some distance and keep all of this in mind, because our health should be the priority. And here it's saying that this virus is transmitting at an optimum rate. So this decision that I had already talked, that it is not only in the hands of center and state, but also in the hands of local bodies, and they can make it seeing the local circumstances in that area. It is, of course, a step forward that a vaccine, a three-dose Zycovid, has been approved for 12 to 18 age group, but this is to be administered only from October. The reversion of physical classes will therefore have to be carefully calibrated. So it's saying that until now we had COVID-19 vaccines only for people above 18. Okay, above 18. But now we have also got a 3-dose Zy-COVID vaccine that is for children ranging between 12 to 18 age group. But it is not being given right now, and it because it is under administration and everything, and so it will be given from October. The reversion basically means the reverse, like after coming back to the normal, or to coming back to a thing after a long pause or a gap. So now that we are coming back to the physical classes right now, so we need to be careful. And here calibrated basically means to often instrument marked with scale or reading, as I told you. So we need to keep things in mind, and everything need to be watched, and we need to take steps accordingly. Now, yeah. Vaccination of children over 12 years of age has been allowed in some countries, but the pandemic's course has remained unpredictable. In Israel, one of the most vaccinated countries, with an estimated 78% coverage of the over 12 population, the Delta variant swiftly caused a spike in infection as distancing norms, the mask mandate, and travel bans were eliminated. So here it's saying, in some countries, the vaccination is even has been even started for children ranging from 12 to 18. But like it's given an example that is in Israel, where they are vaccinating people at an optimum rate, and also the young children, that is from 12 to 18 and above. So they have almost vaccinated 78% of their population, but still, due to the fact that they overlifted all the bans and all the restrictions, that now people were not wearing masks, not maintaining distance, and all of these casualties have resulted them have costed them a lot. And now that, with the fact that now the COVID-19 cases are increasing there, and more cases are coming every day, and this is increasing every day. More and more people are getting infected. Okay, so it's saying that vaccination is not the only only way we can prevent it. Even if we get vaccinated, we need to follow all the precautions and restrictions that have been laid forward by the epidemiologists, politicians, and everyone else. In one instance, an entire class of students was infected by one unvaccinated child who had been on vacation. So here it's saying there's one instance in Israel, where there was one child in the class who wasn't vaccinated, and he went on a vacation, and then like on a tour to some place, and when he came back, he infected all the other children of the class who were already vaccinated. So here you see, vaccination is not the end goal or anything. This cautionary tale serves to emphasize the importance of priority vaccination of children, starting with those who may have other health conditions, maintaining safety protocols, and adopting low cost non-pharmaceutical interventions such as good classroom ventilation and open air instrument wherever feasible. So here it's saying that this situation is trying to emphasize on the fact that you need to get your child vaccinated at any cost, because, and especially if your child has some other disease, because if your child has some other disease, his immune is already weak, and he's more prone to catching the COVID-19 disease, and that child will have more effect or more impact on their health. So, and the other is that maintaining safety protocols. Even after you get the vaccines, and even if you haven't got, you need to maintain and follow all the safety protocols that have been laid down. The next is adopting low cost non pharmaceutical interventions. So it's easy to prevent this. You do not need hi-fi medical instruments to just prevent and all of that. You can just use simple methods like conduct classes in open space, so that wherever it's possible, obviously it's not possible to conduct all the classes in the open air, but you can try some. And open air instructions wherever feasible. So it's saying try to maintain distance and follow all the protocols at the minimum cost you're able to, because if you try hard, then you can do anything that's possible. Like if it's not feasible, then do not run after it. Try some simpler and affordable method to prevent it. Okay. Credentialed studies in US indicate that there are effective measures along with vaccination. It is vitally important for the center to share information on school reopening experience with all states and issue alerts in real time to enable decision making. So it's saying the United States, that besides vaccination, there are other very effective methods you can use to prevent COVID 19. And it is also very important for the state or the center to share, to let the schools share how they are able to manage in this COVID 19 and how things are working. Like if a school comes up with a new idea to prevent this COVID 19, this epidemic, so sorry, pandemic, not epidemic. So pandemic, so they can share it so that other schools can also get ideas, and they can also use the same ideas to prevent COVID 19 infection in their schools. Okay. And okay, an empirical approach will also enable organizations such as National Institute of Disaster Management collate useful insights. Parents must be convinced by transparent official measures that the health and education prospects of their children are in safe hands. So here it's saying that we also need to take help of, uh, like we also need to give chance to uh, organizations such as National Institute of Disaster Management, that is NDR. No, this is not NDRF, but yeah, okay. So we need to also give them chance, so that we need to collaborate with them, so that they can also suggest us some things, and we can follow them to prevent the COVID 19, and we can take help of different organizations in this time. And also at the same time, here it's saying that the uh, parents, like the parents need to know everything about their about the schools, like how they are managing everything, because the schools need to be transparent to the parents, and the parents need to know everything, like how they are going to manage, like safety precautions, how the school is taking, what all safety precautions the school is taking, and everything, because the their children, sending their children to the schools, and by this they're risking their child's life, and which is most important or most close. Their child is the most beloved or the loved ones to them, and they do not want to lose them. So the schools need to be transparent to the children, to the parents, and need to tell them everything. And so that in time, uh, like steps can be taken, and further risk can be reduced. So also, so that this will ensure that their prospects of their children, like including education and health, are in safe hands. So like they're assured that yeah, okay, our children, even health and education is okay, is in safe hands. So yeah, that was the article that came in the newspaper today. Okay.